One of the fundamental principles of doing team-based collaborative care, of doing a patient-centered medical home process, is to risk stratify our populations, to really understand what level of risk does a given patient with a given chronic illness per se have, and when that level of risk is identified, it defines for us a patient care pathway that we have used scientific evidence to define a workflow around. Each level of risk defines a different workflow because of different needs of the patient. So how can best doctors help? Well, it's obvious that for the higher risk patients, for the patients with any kind of complex problem or multiple chronic problems, that the service that Best Doctors provides, or the services provided, the interconsultation, the expert consultative service, either of a total picture or of a focused set of questions around a complex patient, in that particularly high-risk part of the pyramid, that's where they shine. That's where the service can provide a really good set of answers by reviewing the available data, by reviewing all the clinical data that we have on the patient, and putting it together with an expert, someone who is well trained, who's well vetted, who's really an expert and excellent in that medical neighborhood, that medical village that we need, a person who can really give us answers about that particular patient's dominant diagnosis, what the question is about that patient, being sent to the right expert, looking at all the data around that patient, and then helping us with directed, specific answers that give us really good guidance in the medical home for that patient on how do we stay within the scientific guidelines around what the evidence shows we should do, but really modify and work that team-based collaborative care process driven by that patient's level of risk, and then informed by the expert opinions of the Best Doctors consultation process, either the interconsultation or directed answers to a specific set of questions.